second point which we call as a chuku. So that point now you just understand where some people feel the embarrassing to activate that point, but of course when the patients comes to you and you should not say the person is suffering for the piles and female is coming, I just apply the needle on that particular region, you will be all right. But this is in fact is not good, but generally this point is alternative. I wanted to tell you, I told you that DU20, right? You can use it. At the same time you wanted to add up the another point which we called as a Chengshan and then Fiyang, that is UB58 and then UB57. These 2 points also good for the hemorrhoids. Better you can use the alternative points, but don't tell that sir told me that these points are really good to treat for the many diseases, then asking to the patient and you are applying that needle, in fact is not good, right? But however, I wanted to tell about the theoretical part of that, I told you, but practically better you just avoid that point. But of course the husband and wife, anyone is suffering, but in this situation certainly I told you to apply the needle. At the same time the non-medical or the non-acupuncturist people also, they can give the pressure to that particular region to treat for the several diseases. Now look at about the Chugu point. That point is, look at the location. First we try to find out the Shanchu. That point is Ren 8 at the center of the navel. The point is Ren 8. The center of the navel, below that the Phi Chun distal to the center of the umbilicus, on the front midline, the point is called as a Chuku. So here is point is on the pubic region. How to find out that? You can look at, there is the pubic symphysis bone, or we call as the pubic hairs, where the pubic hairs starts, then it goes downwards direction, where the starting point of the hairline of the male or the female, that point to be known as a Ren 2 on the midline. When we look at about the point Henko, that point is located point Phi Chun lateral to the Ren 2. When we see about the point which we call as a Chi Chung, that is the stomach 30, the point is located Phi Chun distal to the navel and then 2 Chun lateral to the midline. All these points, again when you look at about the Fu Hai and the other spleen meridian points, and then spleen 12, 13, these points also located 2.5 Chun lateral, 3.5 Chun lateral, where the femoral vein and nerve and artery is located. All this particular region, so the most of the points are located on the pubic region. Certainly that points are always is good to treat for the genital, that gonads related diseases, especially the ovaries, testis related conditions can be treatable. Ren 2 always is, you understand anything, there is a retention of the urine or the urine flow is not passing properly, or the frequency of urination, polyuria, even this condition also can be treatable by activating. Known and unknown cases, if the patient is feeling there is a pain on the lower geo, lower abdomen, certainly you select this Ren 2 is recommended, right? Still this point is embarrassing to use, since we open and just have a look that where is the pubic region. This procedure also not good most of the times when we are treating to the strange patients, but certainly it's not good by using this point as well. But however, for the complementary to this point, I am giving you another set of the points. But what are the points? Those, and just you have a look right now. The another third point which we call as a Chung Chi, ZHONG, and then Che I. So this point 4 Chun distal to the center of the navel on the front midline. When we study about the Ren 3, you understand there are the 6 move front alarm points are existing on the Ren meridian. So therefore, how the UB meridian having the totally 12 back shoe alarm points are existing, in the similar way half of the points are existing on the Ren meridian. So therefore these points are really very very crucial to understand and also implement to the various kinds of the organ related diseases as well. Now when we look at about the Chung Chi is the mu front alarum point for the urinary bladder. When we understand is the mu means in Chinese that is the front, at the same time it is the great and deepest gathering of that particular energy of that particular meridian and that particular organ itself. So therefore that point is the deepest level the energy is existing of the urinary bladder. When you press and feel the patient, then you understand there is the tenderness is there, that means is the deficiency or related to the urinary bladder having the issues. So once you tenderness is there, patient feels some kinds of the pain on the UB, REN 3 region, then you understand, you just give the pressure, at the same time give the needling on that particular region also recommended. But however, if there are needling to be done as a how to be done this procedure, in fact this also very important. Make sure the patient comes to us around 2 hours ago, 3 hours ago, then he is sitting and then he is taking the treatment after 3 hours. You mean to say that point is also there is a bladder bladder is filled the maximum amount of the urination, even that condition is not much recommended to insert the needle over that point, because already bladder has been distended, the bladder has been dilated. In this condition, make sure that you should not insert the needle deeper level. If at all wanted to treat, make sure that मुझे पेशाब बहुत ज़ोर से आ रहा है, then you are puncturing that will puncture to the outer layer of the mucus layer of the or the parietal layer of the urinary bladder. Then further it goes to the visceral layer internally, then you are damaging to the urinary bladder. So therefore you understand. So just you apply the transverse cutaneous needling towards the REN 2 or towards the REN 4 also recommended, but however this point to be activated REN 3 perpendicular if the patient is have the kind of the atrophy of the urinary bladder. So that time you insert the deeper level needling, that will be helpful to the patient. But or else if the partially filled, it takes around 3 hours. The total capacity of the urinary bladder, how many ml of the urine will collect in the urinary bladder for the male adult or female?
700 ml.
Very good. It is a 700 ml maximum capacity. That's not mean you need to wait till 700 ml. That means around 300 ml filled your bladder, then the sensation comes to you, then within short period, within half an hour or 1 hour period maximum, you need to evacuate or you need to pause the urination. If you wanted to fill continuously, even the women or the girls or we call as a male as well, if they are holding the urination for the longer intervals, then you understand down the line certainly they will get the problem of the lower GO deficiency. At the same time is the back related conditions. At the same time you understand there is the problem with the urinary contractions, sometimes is get changes that leads to the urinary retention or the polyuria frequency of urination later period. When the male also getting obstructed or getting in this way holding procedures they are doing due to some inconvenient situation later on, that also leads to the prostate gland related diseases. Now when you wanted to treat for the prostate gland, this point also activated. Apart from this, there is a point for the especially the prostate gland known as a Chung Feng. That point is liver 4. And also there is the one additional supplementary points to be known as a Chioxin and Sun Inchio, that is kidney 8 and then spleen 6, both the points. So one is there are the 2 distal points and especially the prostate gland is liver 4 and then REN 3. These are the points to be good. Even for the female also having the prostate gland, even you cannot see that, but it is the hidden, it is somewhere is existing that prostate gland. Even to activate the prostate gland for the sexual arousement, even that also good. Even the female having the frigidity where the sexual drive is not good, the loss of libido, even for the male loss of libido, even that condition also can be treatable by activating this point, since this point is regulating the inferior hypogastric artery, inferior hypogastric arteries and nerves. This can be regulated by activating this point. So therefore you understand there are the 3 in meridians meeting point, also called as a Chungche. That point is how the spleen 6 is the spleen, liver, kidney is the junction point. In the similar way, there are the 3 sinuous meridians or communicating point to be called as a Chungche, that is Ren 3, that also the spleen, liver, kidney, all the 3 sinuous meridian communicating point also known as a Ren 3. Therefore when you wanted to treat for the spleen, liver, kidney, you can activate there are the 3 points I wanted to tell you, and the kidney 8 also 3 meridian communicating point, spleen 6 also 3 meridian communicating point, at the same time Ren 3 also 3 meridian communicating point. When I look at about the Ren 4, this also in fact is very important point. I told you Ren 3 is 3 sinuous meridian communicating point, whereas in Ren 4 is called as a Kuan Yuan. So that point is located 3 chun distal from the center of the navel directly on the front midline. Right? This is point to be called as a homeostatic point, immune enhancing point, tonification point, since this point is the move front point for the small intestine, or we call as a tenu intestinal orb. You understand? So therefore the small intestine is the move front, that means is the deep energy. No doubt the Shuaifen, the point is located 1 chun above the center of the navel, that is Ren 9 point, also located on the small intestine. But however this point also treatable for the move front point for the small intestine, treatable for all the mesenteric related conditions, all the intestine related conditions. So this point is what I told you is the Ren 3 is a sinuous meridian communicating point, whereas in Ren 4 is purely spleen, liver, kidney communicating point. How I told you the spleen 6 at the same time is the Ren 4. Both the points if you are activating, then you understand you are treating to the spleen, liver, kidney together. The upper geo, the one is the lower geo you selected, then again you are selecting to the lower geo is lower geo, the word comes here, then you understand from the navel to the foot, right? So from there you are selecting the foot itself, that is lower geo itself. There are the 2 points that is known as a Ren 4 and then spleen 6. Both the points are good point to treat for the homeostatic conditions. When the person feels that the lethargy and fatigueness, you wanted to activate as a tonification point to our body, certainly you can add up 1 point is Ren 3 is always is good. No doubt the Ren 3 and then Ren 4. So this point is very crucial to treat for the numerous diseases related to the all the female genital, at the same time the female reproductive related diseases. Since the name itself is the reproductive channel, name itself is the conceptual channel. Ren meridian is nothing but is the front anterior midline, the whole meridian which is communicating majorly, so treatable for especially for the lower geo. Majorly is the lower geo, in the center is the middle geo, the upper geo. All the 3 geos are regulated by the 1 meridian. That 2 meridians I wanted to tell you, that number 1 is the triple warmer mechanism. The second mechanism is called as a conceptional vessel mechanism. When look at about the conceptional vessel, then the majorly it is physiology is taken place by the reproductive system. So anything related to the genital organs are related to the irregular menstruation, menorrhagia, amenorrhagia, menopause, puberty conditions. From the puberty to the end of the life till the earth passage or the till end of the menopause, the later future also, all the women related diseases certainly can be treatable by activating these points. At the same time, when you wanted to see about the male related conditions, where we call as impotency, premature ejaculation, erectile dysfunction conditions, or the way the sperm motility, morphology and quality and quantity is very poor, even that conditions also can be treatable successfully by activating this point. Sometimes we can able to needle on this region most of the times when the patient comes to our centers. When the patient is coming from the long destination, then you just give one moxa or the moxa stick or moxa roll or moxa kind of the wool, hand over to the patient itself and ask them to activate this area regularly and continuously, certainly there is the major relief by activating this point, since you are directly strengthening to this particular region, so that directly indirectly activating to the hypogastric arteries and nerves. So certainly there will be great changes. But if you activate this point, also the pudendal nerve and the pudendal arteries which supplies to the urinary bladder, that also nourishing to that particular region with the help of the pelvic plexus, right? So when we move on to the another point which we call as a REN 5, right? Yeah, Scheemann. So this point is located. So REN 5 point is located is nearly, that is 2 chone distal to the center of the navel, right? So this point is 2 chone distal, but I don't recommend much by using this point. However, this point is the adrenal point. Move front alarum point for the adrenal point to be known as a Scheemann point, which we call as a triple warmer move front alarum point is Scheemann, that is REN 5 point. So if you activate this point, of course there is the more therapeutic effect as well, but some authors believes that this point is not good to treat for the pregnancy related conditions, but this point is functioning as a contraceptive point in our body. So therefore, when you wanted to use as a Mala D or some kind of the 21 tablets, it comes like which we call as a hormonal tablets, the women take at the 5th day of the cycle till 21st day. So that means to regulate her proper cycles. So in that way, this also works as a contraceptive point is in our in the female body, that point to be called as a Scheemann. Even when we look at about the ovulation period, especially when the ovulation happens midway between the 10th date to 20th date, any date can be possible as per their respective dates, right? But however, in generally, if the 28-day cycle is there, on that is the woman having the on time, then you understand that related to the 14th day and then 15th day. So this particular day, if you activate this point before 2 days and after 2 days, so this point to be as a contraceptive point to be considered. If you continuously do this 3 months, 3 cycles continuously, if you activate this is leads to the sterility to the patient. So therefore, the child bearing patients or the child bearing situation is there, even that condition, the Scheemann point is not recommended. Even for the male, certainly this point is good point to treat for all the adrenal gland related conditions where the so much the corticosteroids and hormones are synthesized by the adrenal gland. No doubt this is activating to the renal system as well. When the patient is complaining about the premature ejaculation or impotency, even this condition also can be rectified by activating and with the strongest stimulation. Make sure that you should not insert the needle greater than 1 chone if the patient is very normal adult. If there is the person is very skinny, even that condition is partially, just you apply the needle, not more than that is recommended, right? You should not insert the deeper level this needling. So therefore, you understand when you wanted to apply transverse direction, you can apply the needle, but you should not insert the needle very deeper level, is not at all good, since you are damaging to the peritoneal cavity. Because of the peritoneal cavity, all the internal organs or abdominal organs are located. You are puncturing to the deeper level. So where how the hernia is come out from the peritoneal cavity due to the damage or infection or due to some reason or hurt or injury or lifting some heavy objects. So all are leads to that problem. When you are puncturing this, that also leads to that problem. Sometimes that should not be. So therefore, make sure that you should apply the pressure or moxibustion or the surface needling 0.5 to 0.75 chune. You can recommend it if the muscles are more fleshy, right? So when we look at about the REN 5 is over, right? So REN 5.2 chune below. So when we look at about the REN 6 point, now it's the beautiful information I wanted to give you, and try to keep it this forever always is good. So now the point is 1.5 chun distal to the center of the navel. That point is known as a chi hai. Chi means is the energy, hai means is the ocean, hai means is the one junction where the deepest energy is located on that particular region, that is known as a chi hai, that is the REN 6 point. So therefore REN 6 also called as in the Chinese known as a Dantian, Dantian is the Dantian area. This is not the Dantian point. Now I am talking about the area. In fact, this area is called as a cinnabar field area. Right, cinnabar is nothing but is kind of the metal which we call how the arsenic metal and mercury is there. So in the similar way, this also it is the mercury point in our body. Mercury is the too much mercury is existing, which leads to the toxicity. Whereas a small amount of the mercury is essential to our body. When we look at about the Greek medicine, or when we look at about the various traditional medicines, they use the mercury to treat for the several diseases. Even for the traditional Chinese medicine, nearly the 40 kinds of the diseases or the 40 related diseases, they are adding the mercury, the small amount for the therapeutic effect. So therefore this point is, they have mentioned how the mercury we are adding in the medicine. In the similar way, this also activating, when you activate this point you are activating to the mercury level, Dantian level. That means the where the deepest energy is existing. Even when we look at about the sadhus, when we look at about the pranic healers, or we call as a Reiki masters, grand masters, they wanted to attune to somebody, they wanted to tonify to somebody, they extract the energy from this particular region. From there again they attune to the person to give the maximum energy to the people. At the same time, when I have apparently known to that some of the practitioners in holistic practitioners or the acupuncture practitioners, whenever they wanted to put the needle to any patient, then you just understand, they imagine that particular region, they take the energy from that and then insert the needle. So that means that energy is flowing that particular region. You understand? So in the similar way, when this deepest energy is existing, then you understand wherever, whenever there is the low energy, where the glucose level is not quite good in the body, the person is not getting the strength, in this level, certainly you wanted to activate as a tonic, as a immune boosting point, where the person having the hypotension, where we call as a hypertension, we select normally the point called as a Tai Chung, that is liver 3. At the same time, when the person having the hypotension, where normally the girls gets the hypotension always, they feel that 100 by 70, 100 by 60, 90 by 60 is the heartbeat, what we call as a systolic and diastolic blood pressure. In this condition, you wanted to bring down to the normal level where the people are not getting. You understand, I am giving a key. Another key is the girls will get or women will get the hypotension because of where the REN 1 is not activated precisely. It's not that mean you need to go and insert the needle. I mean to say the where the husband and wife not interacting each other, not doing the coitus each other, that leads to the hypotension sometimes and headache and low BP, migraine. Always you understand, wherever, whenever you see about the girl who or woman is suffering for the migraine, always is my clinical experience, I feel the low hypotension always. When that condition also, authors also has written that the hypo pressure, that means is the low BP, so that can be treatable by activating the point known as a chi hai. Since the maximum the energy which we call as a Manipura energy is known as a solar plexus energy, below that this point is located. When you activate this point, certainly you are activating to the lower geo, you are activating to the upper geo. Remember how to use this point. When you apply the needle on the perpendicular, of course you can use it where the bladder is empty. Make sure at the same time when you are inserting the needle downwards direction, that you just communicate to the REN 3 Chung Chi level, REN 6 to the REN 3 through needling. You just apply the transverse insertion needle. When you wanted to treat for the solar plexus, get changes, shifted the upward and downwards direction, which leads to the several diseases. Even that condition, you just activate to the upward direction where the person's more energy is required to the top of the vertex of the head. So you just apply towards the top of the head. That means is the towards the umbilicus. You wanted to apply the lower geo, you wanted to activate for the penile organ or the vaginal organ you wanted to activate, then you apply the downwards direction towards the REN 3 is recommended, right? So when you wanted to use this point, the whole area, remember the Dantian is the area midway between the one chun below from the navel and then till the REN 3. So REN 3, that means nearly there are the 2.5 chun, that area called as a Dantian area, or we call as a cinnabar field area, where the mercury area, or we call as is the homeostatic area, or is the sensitive area. Certainly this can be treatable for the known and unknown cases of the diseases which is related to the intestine, which is related to the small and large intestine as well, right? So Chiha is the great homeostatic point in our body. As I mentioned, is the Kuan Yuan, that is REN 3 and then REN 6. Both the points are the key among these 8 points. So majorly most of the points are very crucial and important, right? When we look at about the another point which we known as a REN 7, this point is called as a abdominal ingeo, that means is the fu ingeo. So this point is one chun below from the navel, the point is located, right? But this point is not so crucial, but however the patient is complaining in the lower abdominal pain or the umbilical pain, even that condition can be treatable by activating this point, right? So therefore you understand the REN 7 point is you can insert the needle on the downwards direction or you can insert the needle on the upward direction. Both are recommended to regulate the related to the intestine related diseases. When we look at about the REN 8, the most important point. So here is very crucial and also very happy pleasantable point which we call as a Shen Cho. Shen means is a spirit. Spirit is the good spirit and bad spirit. Both the spirits are there. Even you can look at the navel. Even some girls, they wanted to show the navel. So navel is, if the boy sees that the navel is, feel that kind of the some kind of the pleasantable feeling. So what kind of the feeling he feel, that is a different story. But however the point is located here is at the center of the navel. That means is that through the navel there is a connectivity to the infant. Through the navel there is a connectivity to the mother's fetus of the womb, right? So therefore how the energy is strengthened through the placenta, then you understand this is so important point, because you should not insert the needle on the hollow region. Make sure this is the very key. There are the 2 points on the front of the chest body. You should not insert the needle. What are those points? Come on. Yes? Very good, wonderful. There are the 2 points you cannot insert the needle. One is the Ru Chung. Ru Chung is the stomach, 17 point. The another point called as a Shen Chu, that is REN 8 point, is not at all insert the needle. But this is, however, this to be used as the moxibustion can be applied to this particular region. But however, when we look at about the REN 8, the what are the properties can be treated by activating this point. In generally the point is located on the colon region, then transverse colon, where the colon is there. In that particular region you understand this point is treatable for the anything related to the ascending colon, transverse colon, descending colon, sigmoid colon, and then rectum related conditions. Certainly you can activate this point. When you are using this, make sure there is a small amount. The umbilicus should be partially hollow. partially hollow, and then that should be T-shaped, and that is looks like a good and also the healthy. When we look at about the naval diagnosis, that also it gives a lot of key information about the health issues. But however, when you just wanted to treat by using the navel, better initially you just fill with the crystal salt inside the navel. Perhaps 1, 2, 3, 4, 5, 6, how many stones you can put it inside that, you just put the crystal salts on that, and then cover that by using the ginger slice. You just take the ginger and then make the pieces and then put some pores on that by using the fork, and then make the holes on that and then place it on the salt. Then further you can use the direct moxibustion or indirect moxibustion, or the moxa cone is recommended. However, if you don't know how to use the moxibustion, later on, perhaps after this inshallah I will teach you about the moxibustion very elaborately and extended way, so that you can learn how to be used moxibustion with the practically, right? So therefore, when the dysentery, diarrhea, sprue or abdominal pain or solar plexus get changes or shifted, and due to that reason the patient feel the abdominal pain intermittently and constantly dull pains, all these indications, certainly you can use this point to treat for all the abdominal related diseases. When you could not able to do this procedure, even sometimes you can do there are the two methods I wanted to suggest you. One is you should not apply the needle. The second one, you should use the cupping, or you can use the moxibustion. This particular region always is good method of the treatment, right?